All right, and so we'd like to welcome everyone to today's program. We did tell you that we were going to find as many persons as possible to have discussions on the pandemic, on decisions that we should make, or at least on getting information to assist us in making decisions. And today we have three doctors with us, and of course you'll have the pleasure of getting to know exactly who they are and what area of medicine they are in. We are here with Dr. Claudine, Dr. Gittens, and Dr. Lambert. Lady and gentlemen, hello and welcome.
Hey, Mikey. Hello.
Thanks, Mikey.
All right, so we're going to start by introducing ourselves. We'll start with the way the order is on our screen. So, Dr. Lambert, I'll give you the opportunity to let our viewers and listening audience as well know exactly who you are.
So I am, Sean from St. Paul's. I've been a doctor in the UK since 2014. Graduated from St. George's, did 1 year in Grenada. And my area of specialty is in general practice with a background of obs and gynae.
Okay, well, thank you very much, Sean. And we go over to Dr. Gittens. Dr. Gittens.
Hey, I am Tymon Gittens. I'm also from St. Paul's, born and bred. I'm a pharmacist, so I'm not a doctor of medicine, a doctor of pharmacy. I practice as a community pharmacist in the US, practice in Maryland. I've been practicing for 11 years, and I absolutely enjoy it.
Well, pleased to meet you. And the lone female on our panel, Dr. Claudine, we'd like to say hello and welcome to you as well.
Hello, everyone. Hi, my name's Claudine. I am a pediatrician and I live currently and work in South Wales in the United Kingdom. I am not from St. Paul's. I grew up on Lane and I am a convent girl. I went to medical school in Cuba. Like Sean, I did 1 year at home in General Hospital. And then I worked in Antigua for a little while before moving to the UK. I currently work in general pediatrics, so I do a lot of acute pediatrics, but I am also a clinical tutor. And so I do a lot of medical education with medical students as well.
Okay, good to know that. But since we are on the school thing, you're a convent girl. Lambert is, was it the GBSs you were?
Mikey, come on now. You can't get that wrong. You can't get that wrong. You're slipping already.
No, listen. That's pun intended. Because since we're going to start with the rivalry, I remember, my first memory of you, Sean, is in the intercalls. And you were beating up our school, Happy Hill Secondary, so much, and I could never forgive you for that, because at the time we had some good guys, but they never seemed to be able to shine under Sean Lambert.
Yeah, those were the good old days, man. We had some good rivalries in secondary school. My first love was always track and field, and intercall is where all of it. Well, it was really budding, and I enjoyed. I had a lot of excitement in secondary school. At that time, I wasn't thinking of becoming a doctor.
Right, right. But here you are now, right?
Here I am now.
And Dr. Gittens, talk to us about your school.
Yeah, so I attended Alpha. Claudine did too, and then to GBSS with Sean. Well, I was 2 years below Sean. And then from there, TAMCC, and then to Howard University in Washington, D.C., where I did pre-pharm undergrad and then the doctor of pharmacy program.
All right, great. So
Timmy didn't mention he was a head boy, so he's always been a very distinguished guy. He's trying to make it humble, but he's quite accomplished.
Oh, so you were a head boy, huh?
I was the head boy at GBSS for 2001. Yeah.
All right. Okay, good. Well, good to meet you guys on this forum. I think we will be happy, our viewing audience will be happy to know that we are all Grenadians with one common interest, really, to see Grenada thrive right now, to defeat COVID-19. It's been a struggle for the past few months, weeks, it has gotten worse. Now we are up to 70 persons in hospital, according to our last dashboard. There were about 55 positive cases yesterday. Active cases stands at 1,251. We've been having some recoveries. We had a total of 3,803 recoveries. But the downside to that is we have lost many of our elderly citizens. We have lost 141 individuals to COVID-19. Many of them in the last month were elderly citizens. And so it is important that we have this discussion in terms of how we got here and how do we stem that tide? How do we get the numbers down and defeat COVID-19? I'll start with Dr. Lambert. Dr. Lambert, based on your practices and your experience, what would you say was the main contributing factor of what we are seeing now, the Delta variant wreaking havoc in our communities?
Well, Mikey, first of all, I just wanted to say, our thoughts and prayers and condolences go out to the families who've lost loved ones. I've known many people who have. And it is a travesty, particularly in the month of September. It literally has wreaked havoc in Grenada. So it is a very important issue. But I think early on, if we look at when things started, when this pandemic started around, the spring of 2020, there wasn't much information out. There wasn't much hope on the horizon. In fact, we were anticipating, getting a vaccine or anything out by the following year. So, things were looking quite bleak for us. I think that itself didn't filter down to places like Grenada, which were low-income countries. But in Europe and in North America, at the time of the pandemic, at the height of it when it started, things were collapsing. I mean, literally, the rota systems were running very different. And during that time, doctors were not really on the shop floor, but they were running quite thin. So where Grenada is now is where we were about a year ago. So I think, first of all, to start answering your question, there was a misconception and a misunderstanding of how serious this is, all right? Because people were not affected at that time. We were talking about single-digit deaths by the beginning of summer in Grenada this year. So people didn't really see what was happening before them. They saw what was happening outside of Grenada in Europe and North America, as I said, but they didn't have that experience, and experience is your biggest teacher. So I think that was an issue. I think one of the second things, I think there was an understanding of how we could battle. There was a battle of information going on. And you saw a surge of misinformation, disinformation being disseminated. And people became very gullible. Overnight, we had people become graduates of medicine, pharmacy, pharmacology, and instantaneous doctors, I would say, all right, with a plethora of knowledge that was not supported by anything relevant. And these people continued to sort of perpetuate a lot of misinformation. And so I think in that in itself, with a combination of poor experience, and not to mention the fact that we have an infrastructure, a health infrastructure that's not well equipped financially, and it doesn't have the human resources to manage things like a pandemic or an epidemic. We struggle on a day-to-day basis. So all these three things contributed to us getting to where we are now. There is hope on the horizon, though. I think the message is getting through, albeit at a much slower pace and albeit at the cost of lives. But I think there is a lot of hope on the horizon. And I think the mood has changed and things are shifting in the right direction.
Okay, Dr. Lambert, what is the way out of what would you say is the way out of this, the current situation, and specific to Grenada? What's our way out?
I think it's multifactorial, Mikey. It's not. I think it's obvious that COVID is going to be here for a while. I think one of the ways that we out is the fact that we need to understand what we're dealing with. I think the public domain needs to understand. Let me give you an example of what I mean. I was in Grenada in August, right? I was there for 2 weeks just on holiday, and in the length and breadth of Grenada, I had over 150 people, because I counted, in St. Mark's, where my wife is from, St. George's, in St. Paul's. I was on the Carnage, and many people asked me questions about this. All right. So I think the first thing is an understanding, not just of COVID, but if we were to go forward, it's an understanding of what this condition is and how we can curb and how we can prevent and how we can treat and manage with the resources that we have. All right. The other thing is that we need to reform and rejig and recalibrate our expectations with the resources that we have. And that number one is how we train our doctors at home and abroad, and how we can contribute towards the diaspora can contribute towards Grenada's development, particularly in health, because we've got a large number of doctors abroad in the UK. The majority will be based in the US, but we've got a lot of people with expertise and experience. So these people can contribute even remotely, as we see now, towards the future of Grenada in healthcare. And the other thing that we can do is start to look at ways we can finance a healthcare system which can facilitate us. I mean, one of the things that we're looking towards is how big tourism is in Grenada. But if we don't have a healthcare structure support a first-class world resorts, then there's no point to it. You know, if people like me, Claudine, Timmy, and lots of other people, lots of young Grenadians who are well experienced, well informed, have relatives who want to go back to Grenada, health has to be at the forefront. So it's a lot of parts to play, and it's not just throwing money at a problem. It's throwing money at a problem in a clear, logical way that is manageable with the demographics, and it reflects what we have on the ground. And on the ground, people just don't understand what they're dealing with, and probably know the experience that we have. We can turn things in a different direction.
And I think what we're doing here is key in really getting this to where it needs to be. Just having these sort of discussion, as you have mentioned earlier, where there were overnight doctors and so on, who seem to have had the air of a lot, especially on social media, and so that impeded the penetration of factual information. And so I think that has contributed to what we are seeing as it relates to the low number of persons who have been vaccinated so far, and we're going to get to that. But we have seen, Dr. Claudine, we have seen many of our elderly citizens would have died from COVID-19. But also, what we have seen is a lot of young children were also infected with COVID-19, and that was very different from what we saw earlier last year. It seemed like children, they were immune to COVID-19, but probably it's the variants, I'm not sure. But here, we had nobody, we had no children contracting COVID-19. Now we have heard so many children contracting COVID-19. How concerned should parents be right now as it relates to their children and COVID-19?
Well, you started this question with elderly people, and I immediately started to panic because I was like, I hope you're not going to ask me anything about adults, because I do not know. Interestingly, the British Pediatric Surveillance Unit, the BPSU, conducted a study using, I think, over 100 primary schools, where they looked at children they tested children for antibodies. And interestingly enough, it was about 12,000 students and their teachers. And interestingly enough, the children had an antibody positivity rate similar to that of the adults in the population. Now, that's a lot of medical jargon. What that means is, although we used to think that children didn't get infected with COVID at the same rate of adults, they actually do. So a year on from the start of this pandemic, we now know that they do get infected. They're just a lot more likely to be asymptomatic or have very mild symptoms that may not be recognized. So while you'll find that children are getting infected, and we're seeing a couple of them coming into hospital at this point, or in the most recent wave of the infection, the rate of severe illness is still only about, it's less than 5 per 100,000 children. So it's still a very, 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 very small amount of children. But they are not immune. They are just like all the rest of us. And as we know, children are very prone to getting infected with viruses. It happens throughout, especially in that first 5 years of life. They are having a lot of viral infections, and that's no different. COVID is no different.
And now we are hearing conversations about children being able to receive vaccines. I know that Pfizer, they went down to about 5 years now, right? So 5 years and over, they can be vaccinated, and so that is added protection for them. But as a pediatricianist, are you concerned about vaccinating children? Are there likely to be any long-term effects? Because, and I'm asking you this question because we hear parents articulate that concern, especially now when it comes to vaccinating their children against COVID-19?
Well, now I'm going to first speak as a 80s baby, and then I'm going to speak as a doctor. So as a child of the 80s, we all, the people who can remember, I remember lining up and getting my my MMR vaccine in the computer room in Alpha. And the whole thing was to remember was that you did not come out of that room crying. There were 2 children that came out of the room crying, and I still remember, and I was 5, and there was no concern about, oh, what's the vaccine going to do? Because people remembered knowing people with measles that were dying, and with German measles that were dying, or who had babies that died, or who had severe illness during pregnancy. So when they heard there was this thing that you could get to prevent that from happening, yes. And the vaccination rate in Grenada and in the Eastern Caribbean in general is quite high. So it's surprising to me that there is now this large vaccine averse population in the Caribbean. And I'm not sure where that comes from, because if you want a cohort of patients for vaccine safety, you could use our population. You could literally look at the guy next to you because he's had vaccines all throughout his childhood. We start vaccinating children in infancy. So, and medicine has progressed, and medical technology has progressed so much since I was a child. Now, if somebody was to offer me medicine right now from the 80s, I mean, the safety of that medication, I might not take it, as opposed to if you're offering me medication that was developed this year, I would be much more inclined, because safety, efficacy, the checks and balances are so much more rigorous than they used to be. And the vaccination of children, while it is to help prevent things like severe COVID illness in children, so things like PIMS or multisystem inflammatory syndrome in children, so Kawasaki-like disease for people who may have heard of that. It is also to hopefully help protect the rest of the population, because that is what vaccination is about. It's not just about protecting yourself as an individual, it's about protecting us as a community. And we have always been a community-oriented type of people, but recently we've been much more individualistic, and that's what I've been seeing. And it's like, well, my child is fine, and my immune system is okay, so I don't care about protecting the rest of the population. And I find that, in a single word, I find that sad.
Okay. All right. Well, thanks for sharing that passionate response. Well, we are going to get, as we are talking about vaccines now, we're going to talk to Dr. Gittens here. And I know, Dr. Gittens, I think that is the most technical part of the whole COVID-19 experience, COVID-19 fight, the whole conversation of vaccines, the vaccine safety, whether or not there are going to be any adverse reactions to the vaccines. So, let's talk about COVID-19 vaccines, and of course you could back that up with your history, because I know you've been in medicine about, you said about, with 11 years of experience. How safe are these COVID-19 vaccines? Okay, to me, I think we have lost you for a moment. I don't know why, but we have lost. Let's see if we can get him back. We're seeing you. I know you're... Timmy?
Oh, Mikey, you hear me? You hear me?
Yes, we're hearing you. So go ahead.
Yeah, Mikey, I think that's a perfect question. With regards to the vaccine safety, and I think it's something on everybody's mind, even me as a pharmacist. These vaccines go through like rigorous testing. There are agencies that have people that are dedicated to reviewing the material, like peer reviews. I think, especially as Claudine has mentioned, and as time has gone by, the kind of effort and details and stuff that's learned from the past on vaccine development has come a long way. You'd notice that the vaccine, didn't take that long for us to be able to have something that's pretty the efficacy is great. With regards to taking the vaccine and thinking that, fine, is this safe or not? There's no question in my mind at this point that the vaccine's safe. A big part of that has to do with, one, the regulation from the FDA with particular to Pfizer. And I'm sure there's a similar body that would have assessed the AstraZeneca vaccine, which is also available in Grenada, be it from Canada or in the UK. The other aspect of it is that studies typically show long-term effects or serious adverse effects that cause long-term health issues with vaccines normally happen within about 6 to 8 weeks after the vaccine was received. Now, not only have these vaccines gone through the clinical trials, there's still some of them still going through, but not has it only been a case where they've been approved for emergency use authorization. So they've gone through preclinical trials, they've gone through phase 1, phase 2, and phase 3 trials. It's a case where this has been going on since last year. So it's now at a point where it's way past that 8-week period. We know, in particular now for Grenada that now has Pfizer available, if there's a time that you could probably feel comfortable of getting a vaccine, would definitely be at this point. It's way past the period where we would have been really concerned about serious adverse effects that cause long-term health issues.
Okay, and I take note, you mentioned the Pfizer. Is there a better vaccine? I mean, we have two, so let's speak in context of what we have.
That's great. I tell my patients all the time, the best vaccine is an available vaccine, right? So it does not matter if it's Pfizer. This is not a matter of, I prefer Nike or Adidas or so. Society typically tends to be very brand oriented. This is not a case to be brand oriented. The best vaccine you can possibly have would be an available vaccine. Yes, there will be reasons probably where under very, intense circumstances, you may choose one over the other. So, there might be cases where someone may be really hesitant about the news about severely rare clots with the AstraZeneca vaccine, so they'll probably choose the Pfizer. But either way, or in vice versa, somebody probably heard something about pericarditis and myocarditis with the Pfizer vaccine, so they tend to go towards the AstraZeneca. Either way, these are severely rare side effects, so either vaccine that's available is the vaccine that you want to choose. There's no preference.
All right. One of the things that I think about, and I'm coming to Dr. Lambert now, when I think about getting COVID, I don't think more about the now, but I think about what long-term effect it may have on me. I think a lot of people needs to understand that when they're making decisions as to whether or not they should take their chances with COVID or get vaccinated. What should we be concerned about when it comes to
Yeah.
long COVID, what COVID can do to you, say after you are no longer have that viral load in your body to test positive, but what we call a long COVID, what are some of the what are some of the effects it has on the body? Or how does it
So
manifest itself in the
one of
body?
one of the challenges of COVID is that you have roughly about 5 to 10% of people having something they call long COVID, where they still experience symptoms of COVID and they may or may not test positive for COVID. So they may be negative, but they're having pretty much the same symptoms that they had whilst they had the infection. So they may have shortness of breath, they may have ongoing fatigue with something called a brain fog, they have alopecia, which is hair loss. They can have reduced sense of smell for a very long time. Those are some of the long-term effects of catching the virus, suffer through the virus, and having some form of natural immunity to the virus in the future. So now the challenge of that is that not everybody experiences that. The challenge of that again is that there's no diagnostic test to say that, yeah, this person is classified as long COVID. Long COVID is basically a constellation of symptoms that somebody tells their GP or their primary care doctor or their internist that that's what they're experiencing, and they're then put in that class of patients. And the other challenge with that is that there is no treatment for something like that. Again, the treatment is pretty much the same as you would with COVID. It's a conservative management. You manage things based on symptoms. If you're having pain, you give them some paracetamol, or you start off with something called NSAIDs regularly, resting, asking them to see how they can get their work adjusted, things of that nature that you would see. There's a lot of hope on the horizon for things like people who've lost smell. I think there's ongoing research now at University of East Anglia with regards to use of vitamin A in people who've lost a sense of smell, and managing people under the care of a rheumatologist for people who are experiencing things like brain fog, which we see very similar symptoms in people who have things like chronic fatigue syndrome or polymyalgia rheumatica. So, that is part of the concern, and that's why the drive to vaccinate patients, to vaccinate people and the population at large is so important. That we're not just concerned about what can happen in the acute phase, but certainly what can happen in the long-term phase, or a long effect, because you have to remember there's still a lot of debate out there as to the origination of the virus and the effects it can have and how we can manage it. So a lot of data is still to come out from it, and that's why I think the best solution to this and the best way forward would be prevention rather than cure. And as a primary care physician, I would certainly opt for that, because it certainly prevents you from getting a severe form of the disease, which is what the vaccine has been shown to do very effectively.
Okay, just clarify this for me, please. So persons who are vaccinated, are they less likely, or they will not experience long COVID at all?
So basically, persons who are vaccinated are less likely to develop severe forms of the disease, i.e., they have the likelihood of them being hospitalized, for example, according to the CDC, is much less. The likelihood of them developing severe disease, so i.e., having to go to an HDU or an ITU, is significantly less. The likelihood of them dying is about 25-fold decrease. Okay, but to say that someone who is vaccinated and won't have severe COVID, I can't say that. I don't think anybody can. One thing we know, Mikey, is that there's no COVID expert out there. All right, we just have to play this by ear. If anybody can rubber stamp what COVID will do next, they're selling misinformation, and that's what I mean. If you look at even how the variants are right now, if you look at the Alpha variant, the Delta variant, the Epsilon variant, which is coming along now, we even see the way they're presenting how they're manifesting themselves in symptoms quite different. We even see that, for example, the rate of transmissibility is significantly higher in the Delta variant. The rate of hospitalization is 2.5 times compared to ancestral strains. So there's nobody purely understands what will happen with it. There were several studies that were done that suggested that natural immunity played a role, for example, Alpha variant, but less so with the Delta variant. All right, so it's hard to rubber stamp anything with COVID, because there is no such thing as a COVID expert. We manage patients in the UK primarily based on symptoms because they, trust to trust. If you ask me our trust protocol and you ask Claudine what is her trust protocol on COVID, they'll be very different. And these two trusts are probably about 200 miles apart in the same country. So I can't rubber stamp it and say what will happen. What we say is that prevent yourself from getting to that state. Do everything you can. Use continue to use your mask, sanitize, wash your hands, have a healthy diet. Vitamin D has been proven to help as well. Rest, sleeping, exercising, take your vaccine, and see where things go. And keep your fingers crossed.
Keep your fingers crossed. I want to go over now to Claudine. On the same question of long COVID, Claudine, are children likely to develop long COVID as well?
So there's an emerging study in the UK that is looking into that, because there is some anecdotal, meaning there's some stories that doctors share and that you see here and there about children having long COVID, and it has been reported in other countries, so like the US and Australia. But we don't really know what long COVID means in children. We know that it's much more likely to be reported in an older child, so that the preschool age children under 5s tend to not. We haven't heard of any reports of long COVID in that age of children, and we know that the children that we have heard of symptoms of long COVID in are the older children. So as you get older, the likelihood is higher, but it is still incredibly rare. That's one thing. The next thing is, one of the things that I found interesting when I was looking at what the clock study was going to do, which is the study that's going to look at long COVID, is that they want to have the patients themselves define what is long COVID. So the child or the young person saying what it is that they feel or what it is that they have experienced, as opposed to us as the adults or as the healthcare practitioners telling them what the adults are feeling, and therefore this is what you must feel. That's one thing. The other thing is, I think for everyone, especially for children, the childhood and including from infancy and adolescence is a time of a lot of development, of changes, including what we call neurodevelopment, meaning development of the brain and the way that the brain makes communications with other parts of the brain. And part of that is socialization. And there are children who have missed out on quite a bit of that, especially missed out on education, because for children, as we know, who didn't have as much access to the internet, even in the UK or in the US, or have access to electronic devices to be able to access school, or parents who weren't as invested as others, they missed out on quite a bit of education. So does that get classified as long COVID? What about those long-term effects to that child's education, neurodevelopment, the development of their social skills, their long-term financial effects for that child's life? And therefore we know that children who are, or people who have a lower socioeconomic standing tend to have more illnesses and have a shorter lifespan. So does that get considered? What about children who lost their parents in the ITU, or themselves were admitted to the ITU and now have PTSD from that? Does that get considered? So it's kind of exploring what exactly is long COVID. And yes, the symptoms that Sean described are definitely included, but I think our thought process needs to be broader, and which is why we need to get this under control even more, because the effects are not just to the physical, but there's so much more that we have to consider to this child and their life and their lifespan as well.
Okay, thanks for that explanation. I just want to delve a little deeper into children and COVID-19 as we continue our discussion. How can parents detect, or when should a parent start saying to themselves that the symptoms my child is exhibiting is likely to be COVID-19?
So it's the same symptoms that you would be looking at for any acute viral illness. So you're looking at things like fever. So fever should definitely be there. And I would have a high suspicion if my child had a fever. And if there was respiratory symptoms, so meaning runny nose, sore throat, cough, including and up to difficulty breathing, or what we call cyanosis, so turning blue, going pale, or struggling for to maintain your oxygen levels. You'd also be looking at things like bad belly or tummy symptoms, so tummy pain, diarrhea, vomiting. These things can also be symptoms of COVID. Achiness, generally feeling really lousy, headache. All of these things should make you suspicious, especially if that child is in a community where there is COVID, and if they have been in contact with people that have also had symptoms.
Right. And so now that you start suspecting that your child might have COVID-19, I know that as a parent, Sean, I know you're a parent yourself of young children. I'm not too sure of our friend here, if he's Dr. Gittens, if you're a father as well.
Yep.
But you know how difficult it is to distance yourself or to start thinking about yourself when it comes to taking care of your own child. And I see. How should we? How do we go? Do we go about caring for a child who is COVID-19 positive and don't get infected ourselves?
I don't really have any advice on that. You are a parent first, and to tell a child who is 2 and is feeling incredibly lousy that they should wear a mask and that you will wear a mask, I don't think that will happen. I think it is, again, this is reason for that goes in favor of vaccinations. So if you were vaccinated, then you would feel a little bit more confident, because you would know that the likelihood, if I was to get infected by looking after my child the way that my child needs me to look after them, is that I will not get a severe form of this illness, and therefore I can remain in service of my child. The only things I can tell you are the general advice would be to wash your hands often, try and avoid being in close contact with the child when they're coughing, but I don't know again how you're going to do that, because especially in the preschool age child, they want to be comforted, and I think it would be much more detrimental to that child to not comfort them, and the type of what I want to say is attachment disorders, but I recognize that I will need to explain that. So the way that could affect the child in the long term, and could affect the way that they feel about being able to rely on you as a parent. So look after your child if they're sick.
Okay. Straight. I mean, I like your honesty. Sean is coming in here. Sean?
I'll just chime into that what Claudine said there, because I have a real life story. I mean, literally, my house, as you knew that about 2 weeks ago, my wife tested positive for COVID, and I was in work when she phoned up and she said, I'm positive. And so I had to go home because I had to self-isolate. So once anybody in your house is positive, and even though I'm double vaccinated, I can't stay around my patients, so I had to leave work. So I was home. And later on that day, my son's school phoned up and said he was spiking a temperature. And so we had to go get him tested. And later on that evening, the little one, my 9-month-old daughter, spiked the temperature. So they were all in their 30s. So everybody was roasted. My wife was hot. He was hot and coughing, and my little girl was hot and coughing. And you have no choice, as Claudine said. So you manage. You know, instinctively, you are a parent before you are anything else. So you give them the Calpol, you give them the Nurofen as you can. You feed them as best you can. You give them the cuddles that they need. I'm sure Timmy would know that too. And I haven't been unwell. All right, let me just knock on wood with that. I haven't been unwell. But that's part and parcel of the disease, is that nobody understands why that would happen. Why would some people get it and some people don't? Maybe I had it and I haven't been unwell as they have, but they were unwell for quite some time. My wife was having difficulty breathing, but luckily I think it was considerably mild forms. My son was back to himself after about 3 or 4 days. My little girl, a little bit longer she took to recover. But it is something that you do manage as a parent, and as Claudine correctly said, you're a parent first, and then you ensure that you do what you have to do for your child. I wouldn't stay away from them. I'd have to just go in, as I'm sure many parents would.
Yes, I am. And I see Claudine is like, obviously. You know,
Sean, I think Sean has said, Mikey, I just chime in on that because I think Sean has had a really good testament there, and me and my wife's situation with our 2 kids was pretty similar. Of course, I'm a healthcare practitioner, and I don't know, where would have happened, of course, but the kids tested positive for COVID. Fortunately enough, both my wife and I were vaccinated. We were tested. We tested negative. But it is a frightening situation. So, you're worried, what's the outcome for your kids? And my kids are under the age of 12, so they're not eligible for a vaccine. And then, of course, you're worried, too, about the effects of after COVID, as Claudine mentioned, MISC. So you're thinking, like, especially as a healthcare practitioner, all these things are going through your mind. So we've even had the discussion, as soon as this stuff is available for kids, we would want to at least give them a chance to be protected.
okay. And so while your mic is open, we have had a lot of concerns about
I think Claudine has
oh yeah,
question.
Claudine, you wanted to come in here. I'm sorry, Claudine. I'm sorry. Claudine, go right ahead.
I just wanted to say as well, to add to that point, in hospital, if a patient is in and they have COVID, the parents are allowed to remain with that child 24 hours, at least in a non-ITU setting. They're allowed to remain with that child for 24 hours a day. And that is because there's an understanding that contributes to the clinical improvement, meaning that child will actually get better quicker if their parent is there. And that is the same for neonates or newborn babies,
Right.
all the way up to your teenagers.
Okay. All right. Thanks for that explanation. Well, we are yet to get to that stage here in Grenada. Dr. Gittens, now, one of the major problems that we have had here in Grenada is getting people to trust the message of vaccination. There seems to be a belief that if you are vaccinated, somehow later on, there are people who have interest in those vaccines who would likely to use your DNA to do things to their benefit some way in the future. How possible are those things? And these are the conversations that we have. And with all the respects, these ideas are developed one way or the next, but we have to address it. How likely are these things to happen? How likely is it that a vaccine does more than protect you against a disease, a virus or so?
I honestly, so when you hear these questions, I think it's really important that we, take the time out to sincerely address them. These are sincere concerns of our patients. And, despite you thinking it may sound somewhat out there, I've seen, from my practice, taking the time to really legitimately connect with people and on what they're thinking and the concerns that they have goes a long way. With regards to the question about the DNA, these vaccines don't affect or alter DNA in any sort. They don't enter the nucleus of cells or your cells, nor does, the practitioner take or extract something when the vaccine is being retrieved to pass on to some other body for storage of the material or anything like that. None of that happens. People could feel assured to trust the vaccine because it honestly just passes the blueprint needed to express that protein that that characteristic protein that we've all really heard about the virus, which is the spike protein, and give your body which gives your body the ability to now recognize the virus when it's present, and you have you've made antibodies to attack it. Rest assured, there are going to be a lot of these questions, and sometimes people have concerns about, are the drug manufacturers being legit? They're outside and independent external bodies that go over this material. Folks that have dedicated their lives to researching and making sure that what we bottle or manufacture is what what patients get. I think governmental agencies have spent a significant amount with their bodies, so such as, for example, the FDA, in reviewing and making sure that the manufacturing process for the vaccines are legit and they follow good manufacturing practices. And healthcare practitioners, it's difficult for them to, in some sort, after the manufacture process, to even alter the drugs. At that point, you're just getting ready. In particular, with, for example, the Pfizer, you're just mixing it with normal saline and administration to the patient. There isn't anything else that goes along with that.
All right. Okay. Any of you? Yes. Go ahead, Claudine.
I think I'm going to chime in because I'm a pediatrician. I think I have a lot more experience dealing with people who are vaccine averse or skeptical about vaccinations than the other two. I have the joy of having those discussions quite a lot, and it is something that that there are a lot of discussions about in general in pediatrics, especially in the developed world. So you'll see articles about it in the US and in the UK journals and in Australia and all over. And what interestingly they find is that presenting the data in the way that we tend to do it, saying, well, these are the facts and this is the story, does not work. So we could talk until the cows come home and it will not change people's minds. And what I am telling you is actual fact. So it does not change anybody's mind. What has been proven to help is telling people stories. So stories make us seem less like the man or whatever, I don't know. And so I am going to try to use some stories. Now, I think in the Black population, and most of Grenada is Black, we need to talk about, there are certain things that we need to address. It is not impossible for us to think that there are conspiracies that the medical community and the government are having against us that will work to harm us and our bodies. And the reason that that's not impossible, if we're being completely honest, is that the medical professional has done it over the centuries, and governments have done it. Pharmaceutical companies have done it. And if, as medical professionals, we don't look that in the face and say that this is what has happened in the past, then we're not being completely honest about the situation. So yeah, it's happened. It's happened with multiple vaccinations. It's happened with multiple disease treatment, with HIV treatment in Zimbabwe, with syphilis treatment in the US, with smallpox, if I'm not mistaken, treatment in Jamaica. This is back in when there was still an enslaved population in Jamaica. With was it polio vaccine? Could be wrong. In Nigeria, and I think in Ghana as well. So it is something that has happened. So I understand that, especially like in the beginning in the UK, they were saying, "Oh, let's give Black people the vaccinations first," and I was like, "I'm good. I'm a wait. I will wait. I'm not. I don't want anything first." And it's because of, even as a healthcare professional, I am a Black person and a Black woman first. And I'm like, well, why are they offering it to us first? They never give us nothing. And all of a sudden they want to give it to us first? I'm good. But I waited, I looked at the numbers, I looked at the Public Health England data. Luckily for me, there was I had access to lots of medical professionals that I trust. And by 4 weeks in, all of the other people in my department had been vaccinated. And interestingly enough, all of the non-white people in my department had not been vaccinated. And that was interesting, because it meant that we all had that little bit of reservation,
Right.
even as health professionals, even though we were taught to trust the data. We all did. I understand it completely. What I struggle with, and I think, and Sean and I have had these conversations before, what I struggle with is that members of our own community understand that we struggle with this because of our history, and they use that for whatever agenda, and it is clearly making people sick. It is clearly killing us. I have a story not about the COVID vaccine, but about another vaccine that had a lot of controversy around it. And as a doctor of pharmacy, I'm sure that Timmy will remember the whole MMR situation, the whole, was it Jenny Garth? I can't remember who it was, who said, "Oh, it causes autism," and then everybody was vaccinated.
Andrew Wakefield.
I feel as a doctor, I'm talking about the actress who said, "Well, yes, this is true because my son had it," and then publicized this whole thing. And despite the fact that this doctor was proven to be, he was in the pockets of pharmaceutical companies, and he was benefiting from people receiving the vaccines individually and not as a collective, people still went with it. And I have had the misfortune of seeing a child who's, and if I talk about it, I may become emotional, because it really is something that has stayed with me a very long time. It was a child whose parents did the right thing. They vaccinated her on time. But it was at a time when in her area, here in the UK, there was an outbreak of measles. And she was in hospital for a different reason. And she had this rash. And they said, "Oh, it looked like a viral rash. It's around the time of your children get lots of viruses. It's fine. You're fine." And she went home for something that was completely on. So she was discharged from hospital and she was fine. And then this beautiful 5-year-old child now comes into hospital. And parents are saying, "She's so clumsy now. She was reading a couple of weeks ago and she can't even read now. She's making so many mistakes. She was playing football with us in the summer and now she can't do it." And that child has one of the rarest complications of measles, and it was because of this complication, because it's fatal. There is no treatment. And not only is there no treatment, it is a slow, agonizing death. And that family has to watch their child die in that slow, agonizing way because other people believed a fake study, a doctored study, believed misinformation. And that is what is happening here. Grenada went from 1 death to 140, and people are still saying, oh, well, my immune system can fight this off. And the elderly in our population, including one of the oldest people in the world, is now gone. And we're not seeing that there's a correlation between those two things. And if I could say anything, all the data is there. 40 million people in the UK have been vaccinated. They don't really want our information. And I know that you see, when we do injections into the muscle or into tissue as opposed to into a vein, you'll see that people pull back, and it's because that's how we were taught to do it. So you pull back to make sure that there's no blood, and then you push down. But it's not because we're taking anything from you. The person that's vaccinating you in the health center in Grenada, in Happy Hill, how are they sending the data back to Pfizer? Like, it just doesn't add up. And we cannot allow for so much research and for so much, our own bodies, our own Black bodies have been sacrificed for centuries of medical research for other people to benefit and for us to die now? Sorry, I've been ranting, but yeah.
No, it's true.
It's very passionate, I was captivated by your story, as you say, that people can relate to stories, and you were telling your story, and I felt it, and so you were not ranting, you were just telling your story. Ladies and gentlemen, I thought, an hour was enough for us to have that discussion. Clearly it isn't, because we're just getting warm, but still we'll have to wrap up pretty soon. On that subject, Claudine, that we were just discussing on vaccines, and I want to go back to Dr. Gittens on that. Now, I know there have been a lot of research. I know that there's a portal that people can go to online to report any adverse reactions to the vaccines, and so. But we hear a lot of stories about vaccine. In fact, we hear of how many people died or had some kind of adverse reaction to the vaccine, even here in Grenada. But then it was only 2 days ago that a health expert here said, we have not had any reports of any adverse reaction other than the regular side effects. So, Dr. Gittens, I know that you may have the data, and so can you share that with us in terms of, on a world basis, what kind of data we are getting as it relates to undesirable reactions to those vaccines?
What I have is the adverse effects typically from the vaccine, like the Pfizer vaccine. So we know that commonly more people tend to have like the adverse effects that report are as mild or moderate. That's 95% of patients. With like systemic effects, we have majority of patients complaining about being fatigued, the headaches, the myalgia, the chills. But regards to deaths, Mikey, I don't have data on deaths caused by the vaccines. I'm not too sure if Sean or Claudine, would have anything on that, but I don't have it.
So in reporting deaths, Mikey, there are two different systems. In the US, they use VAERS, right? In the UK, the one that's been approved by the MHRA, which is the Medical Health and Regulatory Body, is called a yellow card. So what we say is that we see people through the Public Health England, and they report the side effects of these vaccines. So obviously hundreds of thousands of side effects are reported. Now, between 10 to 20% of most of the patients who've had a vaccine, either first or second dose, will report some of the symptoms Timmy has just outlined there. So they can range from sort of mild symptoms, which generally you recover after a day or two, to more severe conditions that we could see, the most common of which with the AstraZeneca vaccine has been thromboembolic events. So clots, right? So these clots can go from your legs to your lungs, from your or to your brains, causing a stroke or something. But those events are quite rare. most likely per 100,000 people, you it's less than one. Whereas in an acute phase so if you're acutely affected by COVID, it's about 33%. So it's a significant difference between the two. All right. Myocarditis, pericarditis, we're talking roughly 5 to 6 cases per million with the Pfizer vaccine, and about 2 to 3 per million for the AstraZeneca vaccine. Again, if I had pericarditis as a complication of a vaccine, I would take it. No, myocarditis is slightly more complicated, but pericarditis you can manage quite conservatively. All right. Now you can get other side effects, which generally are not as severe as the two I've just mentioned, but they can cause long-term and quite scary, debilitating effects, such as Guillain-Barré, where you feel like your legs is gone, and you can see that even with any infective illness that you have. You can get a Bell's palsy, for example. Some women have reported menstrual irregularities as well. But overall, when you look at the report system from Yellow Card, we're still talking about a very, very small number of people. That isn't to say that the vaccine is completely 100% safe, all right? There have been people who have the Yellow Card system has ruled as the cause of death is due to the vaccine, all right? So some people who have had clots. So the data has been reported, but these numbers are very, very, very small. And most of the people who've had those Public Health England and MHRA have outlined as the cause of death due to vaccination have been people who've already had underlying medical conditions. So they've had existing comorbidities, which most likely would have exacerbated their condition.
Okay.
No. So I hope that gives you some kind of explanation to what you're asking.
Yes, I'm very clear on that explanation. All right, I have had a friend who says, well, I am not going to be vaccinated because I have had too many complications. For example, I have body aches all the time, I have anxiety, and sometimes I just don't feel well, so I'm not taking the vaccine. Is that enough reasons for you not to take the vaccine? The fact that you're generally unwell, or you have some sort of pre-existing condition, diabetes, hypertension, have had a stroke or so?
No. In fact, if you have those conditions, that's most likely that you should take the vaccine. Now, if you think that you've been unwell, in the UK, if you suspect that you've had COVID or a fever within 28 days, the advice is that you shouldn't have the vaccine within 28 days. I don't know what the guidance is over in America. I think it might be a bit less.
10 days.
It's about 28. Is it 10 days in the US? Okay. So, but that doesn't mean you shouldn't have the vaccine. If you have advanced renal disease, if you have any sort of underlying malignancy, so cancer of any part of your body, all of the recommendations, if you're immunocompromised from anything, all of the recommendations, all of the guidance suggests that you should have the vaccine. If you have ongoing anxiety, again, I can't see that being a contraindication towards having a vaccine. I think those things are, there's not much reason to not have the vaccine. If I could be very honest with you, but the point of this is really to educate people, to inform people, to make a decision that's informed, to make a decision that's based on evidence, because a lot of people are happy to make decisions on things that there's no evidence to support what they're doing, but are unhappy to make a decision. And I think Claudine has already alluded to that quite poignantly, of possibly why they're doing it, and that's a different area that we could focus on. Probably you need a whole program for that, Mikey. So I won't even bother going back into that.
Right.
But as far as the science is concerned, there's enough evidence. I mean, if we look at our local data, all right, as of today, 97.4% of our people who have succumbed to COVID are unvaccinated. 97.4. That is the highest number I've seen. That's even higher than we have here in the UK and in the US. 97.4. The vaccine was given up to about in the 90s, mid-90s to early 90s, severe COVID. I mean, in Grenada, the numbers are, there's so much evidence there. But it's the decisions that people want to make. I think irrespective of how much data you bombard them with, As
Yeah.
Claudine said again, those things just don't appeal to our people, and we have to find a way to finesse that knowledge into them, to finesse that and curb them in the right direction. Because I actually believe people would listen, but I think we cannot force our people to do it. We need to listen to their concerns genuinely, take them very seriously, show them that we're empathetic, and give them a reason, and we can lead the way towards doing that.
And this has been my
Yeah, Mikey,
yes. Go ahead. Go ahead.
I think part off of what Sean just discussed, with regards to you know a reason not to take the vaccine. There are very limited reasons to not do it, and then sometimes we have patients that discuss or ask about allergies. It's probably very unlikely that you have some allergy to something in a vaccine. For example, with a Pfizer, one of the ingredients we use is polyethylene glycol. So if it is that you've gone to any of the local pharmacies and you've picked up something to help with bowel movement, it's like a powder form, you mix it with water to drink for a constipation. That's one of the ingredients. So it's unlikely that we have a ton of people. Not impossible, but very unlikely. And then when you go to the AstraZeneca vaccine, I believe they use polysorbate, which is present in like tons of foods, ice cream, that sort of stuff. So it's difficult to take something that there's chances that you're on allergic to it.
All right, ladies and gentlemen, we have exhausted our time on the program today, and I'm hoping that sometime in the future we'll be able to meet up again and to discuss further, this topic, because I think that there's a lot more discussion that can be had. I'll give you the opportunity. We'll go ladies first as we get ready to close off today's program. Claudine, to make your final appeal or to speak to Grenadians in the most sincere manner as you've been doing as you wrap up your stint here on the program today.
Firstly, I had my jab yesterday, so I got my booster Pfizer jab in this arm and my flu jab for this flu season in this arm. Right now, my arms hurt, but apart from that, I'm doing just fine. And I'm on call all this weekend, so I better be just fine. I had my 2 jabs before, and I was perfectly fine. I have asthma. I had knee surgery. I've got all sorts of ailments, and it didn't affect me at all. That's the first thing. The second thing is, doctors always say nothing is 100%, and that's because it's true. And we never speak in absolutes because we can't. And I think that makes people very worried. But I think our honesty hopefully should reassure you and not give you more doubt. And hopefully the fact that we are also people of the soil, and faces that you hopefully recognize, that you know that we are being honest and we're coming to you with no ulterior motives. So keep safe, stay healthy.
Thank you very much. Thank you very much, Claudine. And it was a pleasure having you on tonight's program. Dr. Gittens?
I think honestly, Mikey, it's important for us to recognize the importance of getting vaccinated. It's a way out of this. As Sean mentioned, we don't know what's going to happen next. We don't know where the variants are going. But an essential part to dealing with this pandemic was really, to get vaccinated. I know there are a lot of issues sometimes that we, for example, as pharmacists see in the community setting with people having access to vaccines or so. I hope that's not the issue, of course, in Grenada. And even if it is, there's probably a possibility for incorporating more, private-public joint ventures. So if it is that, more private care and private physicians need to start administering them in the office because people feel more comfortable going to and discussing with your doctor to have the vaccine be administered there, that's something we probably could consider as a country. I mean, also from the pharmacy perspective, here in the U.S., pharmacy practice is somewhat very different to that in Grenada. We administer a ton of vaccines. Claudine just mentioned that she did flu and her third booster. Pharmacies in the U.S., it will not have been possible for the U.S. to administer the number of vaccines that they have had it not been for community pharmacies playing such an intricate role in vaccinations. So that's something that Grenada, may be able to consider. Who knows? But overall, the data is there. Yes, the data is there, but the stories, as Claudine says, is this important. The more that we can share with each other things that happen, I mentioned that my kids, I had a situation with my kids. These things hit home. So it's not a case where, like, I'm looking at this situation on the TV or so. These circumstances are legitimately frightening. And it's, for us to be able to get out of this, it's not a matter of like picking sides, vaccinated, unvaccinated, or anything like that. Like, we have to do this together. And the final part of it too, I need to discuss too, Mikey, that often probably doesn't come up on these segments, is that you're not doing it only for yourself, but you're doing it for the broader community. So when it is that we take how delicate or fragile Grenada's healthcare system is, the practitioners that are toiling day in, day out right now like this, this is like the first round, right? We don't know what next may be out there. Medical or healthcare practitioner burnout is a legitimate thing. So you don't know what kind of care probably you'll just be able to get months down the line. We have to put a situation where you're just not doing this for yourself, but you're doing this to uphold and really keep together your healthcare system. If your healthcare system is overburdened, you're in a lot of trouble. And it's not a 911 trying to frighten anybody, but it is a serious event. You don't want a situation where your healthcare system is extremely overburdened, and the people that offer care, they're burnt out. All right.
It's not a 911, it's a 411. All right, thank you for that. And we're going to close off with Dr. Lambert, your final comment.
Mikey, so you give me a hard task, man. You give me you put me last hard acts to follow after you have these two eloquent speakers. There's not much to say, really. But I just think in the month of September, as COVID is coming hard and fast. I've spoken to people at home. I've done 2 shows now. I'm still in the process of trying to get things done at home. I'm appealing to my people in the utmost way that I could be as empathetic and as passionate as I can be. That it is important. Look at your neighbors, look at your friends, look at your family, look at the hospital. We need to have collective responsibility. We need to take everything that we have on board. I'm not against using traditional medicine. I'm not against using alternative ways that you probably believe, but not as a substitute for vaccination. I believe vaccination is the way forward for us. There's enough evidence, there's enough data out there to get it. I know you've been overwhelmed with data from everybody. And now is a time to just appeal to your emotions, really, to do the right thing and help yourselves, help your family, because we really need to make sure that we get through this together. And as short and sweet as that, Mikey.
Thank you very much, doctors. Dr. Lambert, thank you very much. Dr. Claudine and Dr. Gittens. It's been a pleasure. It was a really fruitful discussion. I'm happy that we were able to get this done. I know that our audience have been wanting this kind of discussion, and I'm sure that they will be appreciative of it. So again, thank you very much. I know that it's pretty late where you guys are right now in the UK. It's almost midnight. It's about 11:30 there now or so. I'm not sure. Yeah, it's crazy time, and so
my daughter gonna start crying anytime now, so
they need a little cuddle. All right, so thanks again, and may God bless you and your families, and we'll see you again. Thanks again for making the time to be here.
All right.
All right, take care. And folks, that's where we're going to pull the curtains down on today's discussion. It's been a pleasure again. Of course, we're going to have more of these discussions. You just have to stay tuned to the Mikey Live program. Please tell a friend. Please share the program as well. And of course, you can check out our YouTube channel for this program as well. We're going to upload that there and other programs. Take care and do have yourselves a good one.